I'm Dr. Joseph Ciotola from Mercy Medical Center in Baltimore, Maryland, and I wanted to share with you my patient Mark Baker's story, who you just saw, because Mark had a difficult problem that a lot of people were facing in the country now, and there's a wonderful solution for those patients, which is a revision hip replacement done through the anterior approach. Mark's surgery was very easy. It took actually less time than a regular hip replacement would have taken, and he's doing very well. He's actually doing better than he did when he had his primary hips replaced. And that's because with the anterior approach, there's less trauma to the muscle and soft tissue around the hip. And in Mark's case, all I had to do was open up his old scar, take out some scar tissue around his hip, and then remove his acetabular component, the cup component, and remove his femoral head, which was the top of the prosthesis, and replace that with new parts. And I was able to use the exact same size, or just one size up from what he was before, and was able to get a nice stable construct, was able to reconstruct his leg lengths and his offset, and technically get his hip as close as possible to his contralateral leg as possible. And this has allowed him to recover very well. He has less pain now than he did even from his primary hip replacement. He's going home less than 24 hours after surgery, and has done very well. And I suspected that he would do this because I really did less work to him this time, with just replacing his acetabulum, not having to replace his femur, and not having to cut any fresh tissue. All I had to do was cut his skin and the scar tissue out to get the surgery done. So I wanted to make this, make patients, and make other surgeons aware of this as a possibility for patients that are dealing with this difficult problem and having to consider having another surgery after they've just thought what they had was a hip replacement that was going to last them for many, many years, and now have to go back and have this recalled component revised. Thank you for your time, and I hope this helps you.